The honourable member for Aurora Oak Ridges, Richmond Hill.
Mr. Speaker, public health measures are working to stop the spread of COVID-19 with the number of new cases starting to stabilize. Now is the time to begin to prepare to ensure we are ready at the earliest possible moment to restart our economy. What is the national strategy for supporting virus and antibody testing? When will widespread contact tracing be available? How will the government address critical shortages of medical items? Canadians need to see a plan. When will the Liberals provide a national plan to get this country back to work?
The Minister of Health.
Thank you, Mr. Speaker, and I agree with the member opposite that this needs to be a coordinated national plan, and that's why right now we're working with provinces and territories to address the many facets that she identifies, whether it's research, whether it's support for public health, whether it's boosting up our healthcare system across the country. These are steps that we need to take together and in a coordinated fashion. We'll continue that hard work, Mr. Speaker, and we'll come back to Canadians when we have a plan that will protect their safety first and foremost and allow people to get back to work.
The honourable member for Aurora Oak Ridges, Richmond Hill.
Monsieur le Président, les provinces, les professionnels de la santé et les travailleurs de première ligne font un travail incroyable pour combattre ce virus et nous garder en sécurité. Maintenant, le fédéral doit faire sa part pour que le Canada revienne à la normale. Avant de lever les restrictions, certaines conditions doivent être mises en place. Par exemple, le gouvernement doit régler le problème de manque d'équipements et de médicaments. Quand ce gouvernement va nous fournir un plan national pour réouvrir le Canada?
L'honorable ministre de la Santé.
Well, merci, Monsieur Président. I agree with the member opposite. It's extremely important that we work together with provinces and territories to ensure that we have a strong fabric to protect Canadians' health and safety while we begin the long, hard work of restarting our economy and getting Canadians back to work. This will require research. This will require evidence. This will also require investments in public health and supporting local and provincial governments to do the hard work of contact tracing and isolating close contacts. Mr. Speaker, I'm looking forward to that work with my colleagues, and we'll continue to update the House as we do it. Thank you.
The honourable member for New Brunswick Southwest.
Mr. Speaker, as Canada moves from self-isolation and closures to a gradual reopening of communities and businesses, a high level of testing for COVID-19 will be needed, especially in areas that experience a second wave. Yet concerns are increasing that the federal government has not adequately ramped up the availability of tests, as is successfully done in Taiwan and South Korea. What is the federal government's plan to initiate large-scale testing to coincide with the lifting of self-isolation, and how many test kits are needed to begin?
The honourable Minister of Health.
Well, thank you, Mr. President, and I will say that Mr. Speaker, and I will say that in Canada, we have one of the highest testing rates in the world, and we're very proud of the work that's happening all across the country at all levels of government, but also from private industry who have been racing to ensure that we have new tools and new testing approaches as the science develops. We are constantly working to increase, for example, laboratory capacity, to approve testing kits. In fact, we've approved the use of 10 new testing kits across the country that will help accelerate testing and speed up results. Mr. Speaker, this is a work in progress, but we are confident we're on the right track.